extracellular fluid is the fluid found outside the cell, comprises about 40% of body fluid. The distinctive pattern of electrolyte is high content of plasma. As we can see here, the pink one is the plasma and the yellow one is interstitial fluid. The major cation in extracellular fluid is the sodium, right here. And the major cation in ECF is chloride. Thank you.
Assalamualaikum. My name is Anza Sulawesi Ramzi. I will present about intracellular fluid, ICF. Definition for ICF is fluid found inside cell. It comprises of 60% of body fluid. Distinctive pattern of electrolytes have low sodium and chloride. Chief cation is potassium. Chief anion is phosphate. The orange color indicate that for intracellular fluid.
Hello, Assalamualaikum. My name is Sarah Solfina binti Muhammad Sukri. Today I will present about sodium. Okay, sodium is one of the most important electrolyte in our body. It is regulated by kidney. The function of sodium main is four. First, fluid and function for fluid and electrolyte balance. Second, associated with blood pressure and pH balance in body. Third, required for nerve impulse transmission. And fourth, assist in the transport of certain nutrients into body cells. Okay, normal range for sodium is 135 to 145 mg per m. The clinical significance for sodium is if low, it can cause nephrotic syndrome, hepatic cirrhosis, acute renal failure, and congestive heart failure. While if high sodium, it will cause diabetes insipidus and dehydration. That's all from me. Thank you.
Hi and Assalamualaikum. My name is Hanin binti Muhammad Iso, and I will explain about calcium. So, do you guys know what is calcium and its function in our body?
No.
Okay, calcium is essential for bone and teeth formation, and it's also for blood clotting and muscle contraction. Calcium is regulated by two important hormones, which is parathyroid hormone and calcitonin. So what is the function of parathyroid hormone? Parathyroid hormone it stimulates bones to release calcium into the blood. PTH also causes kidneys to excrete less calcium in urine. As you can see, this is the function of calcium. Okay, work with phosphorus to form bone and teeth, role in cell membrane permeability, participate in blood clotting. Calcium is 99% in bones and 1% in serum. Also, second hormone which is important is calcitonin. Calcitonin produced by cell of thyroid glands, which the function is to lower the calcium level in blood. Calcium has two clinical significance, which is hypocalcemia and hypercalcemia. As you can see in here, hypocalcemia caused by inadequate intake, malabsorption, thyroid or parathyroid surgery. Second, hypercalcemia is caused by cancer and hyperparathyroidism. That's all from me. Thank you.
Hi, Assalamualaikum. My name is Nur Ain Mabibisari, and I will explain about the potassium. Potassium is potassium, aka K+. It's a major cation in ICF. Let's take a look at this. is the major cation in ICF, and it's only 2% of potassium in the plasma and in the ECF. Okay, plasma potassium is a poor indicator of body potassium. Major role of potassium is to create a membrane potential in accessible cells. For example, nerve, muscle, beta cells of pancreas. And what the function of the potassium? Okay, function of potassium is critically important to the function of neuromuscular cells, acid-base balance, ICF volume, control heart muscles contraction, and promote muscular excitability. Okay, regulation of potassium in the kidney is responsible for excreted and deabsorbed in the proximal tubule under the control of aldosterone. Okay, let's take a look about the clinical significance here. Okay, hyperkalemia is mean potassium is high in the blood, which is clinical significant about the hyperkalemia is renal failure, circulatory failure, and about hypokalemia is potassium is low in the blood. The clinical significance is vomiting, diarrhea, renal loss, and GI loss. Okay, what's important for potassium is it's really important for neuromuscular cells. Okay, that's all. Thank you.
Okay, Assalamualaikum. My name is Amira Emi binti Sulimi and I will present about bicarbonate. Okay, as we can see here, bicarbonate is the second most abundant anion in ECF. Bicarbonate is secreted by stomach, but it also present in all body fluids. It is necessary for digestion. Okay, the function of bicarbonate first is to maintain our body pH by acid-base balance status. Next is to reduce acidity of dietary components such as proteins. Since high diet protein contributes to acidified urine and uric acid and hypercalciuria, which is high calcium in urea, bicarbonate can prevent the recurrence of calcium oxalate and uric acid renal stones. Next, bicarbonate also can prevent dental cavity by increasing pH in oral cavity and neutralizing the harmful effects of bacterial metabolic acid. Bicarbonate also can participate in mucous bicarbonate barrier as the first line of protective and repair mechanism. Last but not least, bicarbonate also can help physically active people to combat with fatigue. Okay, as we can see here, bicarbonate clinical significance. When the bicarbonate is low, it means metabolic acidosis, diarrhea, and renal composition for respiratory alkalosis. Whereas for high bicarbonate, it is due to metabolic alkalosis and renal composition for respiratory acidosis.
Hi, I'm Mira. I would like to present about chloride. Chloride is the major anion in ECF. Sodium and chloride is usually associated together, where both sodium and chloride maintain the water balance. Chloride disorder often parallel to the cause of sodium disorder due to passive association with sodium. Okay, the normal range for chloride is 95 to 105 milliequivalent per liter. If the level of chloride fall below the normal range, then it is considered hypochloremia. This is caused by the metabolic alkalosis and the decrease of the chloride absorption. And then if the chloride level fall below, if the chloride elevated above the normal range, whereas above the 105 milliequivalent per liter, this is considered as hyperchloremia. This is caused by dehydration, renal failure, hyperparathyroidism, or respiratory alkalosis.